Hello from Williamson Health. My name is Michelle Simpson, and I hope you enjoy this episode of Health Talks from the Inside Out. Welcome, Dr. Tatalovich, one of our urogynecologists through the Williamson Health Medical Group. Thank you for being with us today. You are one of our first few people to sit down with us for this new podcast, so we are so excited to have you here today. Thank you.
Yes, thank you. No, it's exciting to be here.
I think one of the first questions we have, which is probably what people are wondering, what does urogynecologist mean? What is a urogynecologist?
Yeah, so urogynecology is essentially kind of a hybrid between some urology and gynecology. And so really that means that we can address pretty much anything in the pelvis, actually.
So let's start at the beginning. What drew you to medicine? And how did you eventually decide on urogynecology?
Yeah, I mean, medicine, I just kind of liked the idea of helping people. I actually didn't know I wanted to go into urogynecology until I actually started that whole process. But, going through like in medical school, I just really enjoyed, the field of OB/GYN and just really felt like it was important for women to get to talk to women about, these kind of issues.
So what are like conditions that you treat in your office?
So we can treat, probably most common is going to be urinary incontinence. That's a big one. A lot of women suffer from that. We treat prolapse, where things aren't staying up where they're supposed to be, where they're falling down. We also can do complicated GYN surgeries, so we can also do endometriosis, fibroids. We also do things that fortunately aren't quite as common, fistulas, that kind of stuff. So
there are different types of incontinence, correct?
Yes. The two most common types are going to be stress incontinence, which is classically going to present as leakage with like coughing, sneezing, laughing. Okay. That is most commonly what we're going to see after childbirth. We also have overactive bladder, which is where that bladder is kind of contracting when it's not supposed to, and that's going to give people the symptoms of urgency, frequency, running to the bathroom, feeling like they can't make it in time. You can have both, which is called mixed incontinence.
Do they overlap?
Okay. You can have mixed incontinence, yes, which means you have features of both. Okay. But yeah, there's more than one type, absolutely.
Fistula. What is the fistula? One of the things we're hoping to do with this podcast is educate people on the
hopefully you never have to ever find out personally. But, a fistula, you can have both fistulas that are going to be from the bladder to the vagina. You could also have fistulas that are going to be from the rectum to the vagina. There's also other variations on it. But basically it's where there's a connection between two of the body parts that shouldn't be there. And then that obviously creates issues. Okay. And that usually is going to be a surgical fix. And that's also something that we treat and that we can do.
So how would a patient know if they had that or some of these other conditions? Is it pain? Like, what are the first few symptoms that patients might be experiencing that they realize, I need to go see someone?
Yeah, and a lot of the symptoms are really common. A lot of symptoms I think women kind of chalk up as just normal part of being a female, getting older. Most commonly it's going to be things like leaking. When you exercise, cough, and sneeze, most commonly you're going to start noticing it after you have kids. Right. Tends to get a little bit worse, as you get older. We can also see leakage where people just feel like they have to go to the bathroom all the time, kind of disproportionate to how much fluid you're drinking. That also can be a really common presentation. Essentially, if you notice something that you feel like is different, I think that's where it's reasonable to go in and just see, is that something, that's normal? Is that something that there are treatment options? Is there something that we can do about it?
You just touched on like the number one thing that I wanted you to touch on, because I do think that there's this myth of like, as you get older, this stuff is supposed to happen to you. Like, I feel like that's what my grandmother said. That's what my mom has said. Like, as you get older, like, this just happens. Your hormones change. But like, it's stuff that like affects your daily life. Yeah. And I feel like it doesn't have to. And I feel like there's this taboo about talking about this kind of stuff, and you don't have to feel like that. You don't have to be inconvenienced every day. No, so what would you tell those patients?
No, I think you're exactly right. It's one of these things, it is really common, so it's not a red flag symptom in terms of there's something bad going on. It's normal in the sense that so many women suffer from it, but just because it's normal and we know it happens, doesn't mean you have to deal with it. Doesn't mean you don't have to have those symptoms. Doesn't mean you have to deal with pads and, that kind of stuff. So yeah, we absolutely have things we can do about it.
What are some non-surgical options? Because I'm sure a lot of people may not want to go because they're like, oh, she's going to make me have surgery, and nobody wants surgery down there.
Actually physical therapy works really well for bladder issues, and that's honestly one of the first line things we try, because at the end of the day, if we can get you better without having to do surgery, I mean, that's a win, and so...
And can I stop you right there?
Yeah.
Physical therapy.
Yes.
So the first time we started learning about this service,
it's a different kind of physical therapy.
Yes.
Oh, yes.
We usually think bone and joints and
Nope.
exercise. So
Nope.
could you take a few seconds and explain physical therapy in your world?
Yes, so that is going to be pelvic floor physical therapy. These are going to be therapists who are specially trained. They've actually done additional training beyond what you would do for like back, shoulder, PT, that kind of stuff. But their focus is the pelvic floor. So some of what they do is going to be some internal work. And just part of that is the muscles that we're trying to get access to, the parts of the body that we're trying to improve. Some of that does require a pelvic exam, so there is some of that. But, those providers are very good at kind of explaining what they're doing, why are they doing it, getting patient buy-in, explaining the whole process. It is definitely not done in the gym with everybody else.
Right.
It is
Good to know. Good to know.
It's going to be a private room, but it really works really well for a lot of different things in the pelvis. We use it for bladder issues. You can use it for bowel issues. You can use it for prolapse, which is where things are falling down where it's not supposed to be. I mean, pretty much if it's in the pelvis, we can potentially treat it with physical therapy.
I didn't realize that like pelvic floor PT could treat all of those different conditions.
Yeah.
Do you see like a lot of patients that feel like that solves all of their issues?
Yeah, absolutely. I mean, obviously, people who have more mild conditions are going to do better with the conservative stuff. If we have really severe leakage, really severe prolapse, we're probably not going to get you perfect just with PT alone. But it absolutely can make a big difference. And we see all the time patients who come in not totally ready for surgery yet. We have them go through PT, they come back and they're happy. Now, you do have to keep doing your exercises. It's like any kind of exercise routine. You have to maintain it. But it really does work. It really does work.
So what are those exercises? Is that like Kegels and other things that we hear talk about, or is it different from that?
Yeah, the therapists really do kind of fine tune it for what that specific issue is. So typically you would get discharged and, you've got your list of exercises that you're supposed to do. Kegels, yes, are definitely part of it. But there's also other things that they'll have people do too.
We talked a little bit about robotics the other day when we had Dr. Slater on here. So you do robotic surgery as well.
Absolutely.
What does that look like in your world?
Yeah, so probably the most common surgeries that we do using the robot, one is going to be hysterectomy, and the other is going to be prolapse surgery, which is where we're trying to pull everything up where it's supposed to be. But those would probably be the two biggest robotic surgeries that I do. So.
And how long I know it depends probably on each patient, but what's the average maybe length of either one of those surgeries?
Hysterectomy is probably about an hour, and obviously these are just averages. And the prolapse repair is probably about 2 hours, so not too bad.
And do both of those come with an overnight stay usually in the hospital, or some outpatient go home that day?
So you can potentially go home the same day. A lot of it depends, I think, on just how motivated the patients are to go home that day. And also I think too, time of day really plays into it. If you're an afternoon case, you're probably not going to go home, that night, just because by the time you hit all that criteria, it's going to be the middle of the night. But there definitely is their potential. I do also let people, spend the night if we need it, so it's not like we're trying to rush you out the door or anything like that.
I feel like in your line of work, some people may be hesitant to come see you because it's embarrassing, it's awkward. What would you tell those patients who know there's something going on and need to come in, but they're just like, oh, it just seems so uncomfortable? What would you tell them?
I would tell them that and I know it's easy to say, but as much as you can, just don't be embarrassed. I mean, this is literally what our specialty is dealing with those things that a lot of people do think are embarrassing. And, first step is, telling your doctor so you can get into the right person. But I mean, truly, we've seen it all, we've heard it all. You don't need to be embarrassed. You can't shock us. You know, it's a normal thing that happens, but it's also something that we can fix. You know, we just need to know what's going on. So I would definitely encourage people, speak up, you know.
Do you have a patient story that like really sticks out to you? I mean, with no specifics, but like a situation where you were just like, I'm so glad we could help this person.
You know, honestly, I think like the leakage of like urinary incontinence, I think probably, yeah, I've got a lot of those. You know, so many people, it just starts ruining quality of life. You know, I don't want to go to my exercise class. I don't want to go do this because I'm going to leak. And, you know, we'll treat it, do the surgeries. And I mean, so many patients come back in and say, this is so much better. I just can't believe I waited so long. I wish I had done this so much sooner. So yeah, I mean, all day long, people are just like, you gave me my life back.
I didn't realize how much of an impact like travel, like it had on traveling, because you have to constantly think about going to the bathroom. I think it was one of your APPs that had mentioned that like some people are just so worried to go travel because they don't know where all the bathrooms are, and like I just can't imagine having your daily life impacted that much by something.
And having to pack pads and, you know, and depending on how bad the leakage is, you know, some people, you know, are having to wear, you know, diapers and that kind of stuff. And, you know, who wants to bring a suitcase filled with incontinence supplies? Nobody.
Okay, you just mentioned APP.
Yeah.
So another thing we're trying to do with this, you know, podcast is break down the terminology that we use and that type of thing. So can you explain what an APP is, and then maybe that goes into the people in your office, like in your clinic, if patients come to see y'all, who all is there and who might they be seen by?
So APP is Advanced Practice Practitioner, and another term for that is mid-levels. You can have nurse practitioners, you can have physician assistants, but basically they're just additional providers in clinic. We actually have 2 of them who work, you know, hand in hand with me, see patients, you know, all that good stuff.
So if a patient calls, they might be seeing you in the clinic, or they might be seeing one of your colleagues who could be one of these mid-levels.
Yeah, exactly. It just depends on how quickly they want to get in and what the availability is. But yes, definitely there's potential you would see any of us.
And you do all the surgeries though?
Yes,
so you are
correct.
The physician
they
doing
take care of the office
surgeries,
side of it. Yep, I'm going to do the surgical side of it. So
how long is recovery? So if we're talking about, because I guess pelvic floor PT, I'm thinking this is like a several month process. If you're doing like a surgical type situation, does it? I'm assuming it depends on what type of surgery you're having, but what does the recovery look like?
Yeah, so, you know, the good news is most of the surgeries that we do are going to be minimally invasive. So surgery or recovery is usually pretty fast. You know, we are going to restrict activity a little bit, you know, where we want you up, you're moving around, you know, you go home from the hospital, you know, you're walking, you're eating, you know, all that kind of stuff. Restrictions really are just no vigorous exercise and, you know, no heavy lifting. But other than that, we want you to start adding back in activity as you feel up to it. So,
what do you think is the most rewarding part of your job? What you get to do every day?
I think giving people their life back, honestly. I mean, people really do kind of suffer in silence. So just making them better so that they don't have to focus on all these things they shouldn't be having to worry about. So it's really gratifying, actually, you know, having people come back in and just say, this is so much better, thank you so much. So absolutely, making people better.
Yeah, fantastic. So Dr. Tatalovich, we are back to sit down for a second day. When you were here with us last, we had to stop early for surgery, which happens sometimes, the life of being a physician. So thank you for coming back. There were just a few other topics we wanted to make sure we hit on today.
Yeah, no, absolutely. I'm glad to be here.
So last time we talked a lot about urinary incontinence, but there's another type of incontinence, fecal incontinence. So just quickly, what is that?
Yeah.
Where does that occur? Treatment options.
So same kind of issue as with urinary, except it's just involving stool, and it's essentially where people aren't able to control when they go to the bathroom. Obviously, that tends to be very distressing to people. So we definitely do have, you know, treatments that we can do for that. We always do want to make sure that people are up to date with colonoscopies, all of that. Just making sure there's nothing else going on.
Check the box.
But with fecal incontinence, you know, kind of first steps, a lot of it is going to involve making sure that we're avoiding diet triggers, that, you know, we're doing plenty of fiber. Everybody always talks about fiber.
Yes.
Doing plenty of fiber. But then if those kind of conservative things don't work, there are surgical options too. So.
And is that largely found in older patients, or is it all age ranges?
You know, it is going to be more common in our older patients, but definitely it's something that people can have issues at all age ranges. So it is definitely kind of a broad collection of patients who are going to suffer from that.
And would you say it's as common as urinary incontinence, or just we don't talk about it? So you're shaking your head. It's not as common.
No, it's not as common. It's not as common. Urinary incontinence women is very, very common. Fecal incontinence, no. It is. It is definitely much less common.
Okay. I know another important topic we wanted to talk about was prolapse. So what is prolapse? Let's go all into that.
Yeah, the prolapse is basically where the pelvic organs are kind of being pulled down by gravity. Very commonly, it's going to be after childbirth. And it's essentially, you can have bladder can start coming down, uterus can start coming down, the rectum, the bottom wall, posterior wall of the vagina can start coming down. People normally will notice they're starting to have issues because they will start feeling kind of pressure, a bulge, maybe some kind of discomfort. If they start noticing something like that, then I would definitely bring it to their doctor's attention. That is also something that we can treat. We've got some conservative options for that, mostly physical therapy. There's something called a pessary, but then we also do have surgery.
Is that also a visual symptom? Sometimes you talked about pressure in the bulge, but sometimes might you see changes and things look like they're where they're not supposed to be.
And I will say most women look because they start feeling something different, and then they look and see a bulge, see that there was something there that's not supposed to be there.
And we should look, right? We shouldn't be afraid of that. It's
of course
part of our body. And
it's you and how you're made.
So yes, when we feel something different, let's investigate and check it out.
Exactly.
Okay, so urinary tract infections, often called UTIs. Let's talk about that, because I do feel like that's something that most women will experience in their lifetime. Some more than others. Some have chronic UTIs. So let's talk about that.
Yeah, that is something that's really common, again, in women, and we definitely can see all age ranges. Common triggers for urinary tract infections, sex actually can be a common trigger. Other times they can kind of just happen and don't necessarily have a good reason why. Depending on what we think is going on, depends on what we're going to do for treatment. We certainly have kind of some supplements and stuff that people can try kind of first line. That would be our cranberry
I was going to say, I always hear about cranberry.
Yep. Cranberry, we do typically recommend doing like a supplement, just because cranberry juice, it's not very concentrated and you would need a lot of it. So it's actually more effective to do the supplements. But cranberry is certainly something. There's also another over-the-counter supplement called D-mannose that also helps kind of protect the lining of the bladder, that we also use for urinary tract infections. If that doesn't work, then we have some sterilizing agents that people can take by mouth, and then we've always got antibiotics.
What is a sterilizing agent?
So it's medicine that you can take that is concentrated in the urinary system, but it's not an antibiotic. So it'll kill bacteria, but you don't have to worry about resistance. You don't have to worry about all of the GI side effects that we can see from it. So it's kind of that next step if you're not wanting to put somebody on daily antibiotic suppression.
And what about women as we age, going through perimenopause, menopause? Do hormone changes sometimes trigger more common UTIs?
Absolutely. That's where we will also see a big uptick, is kind of in that perimenopausal, menopausal transition. Vaginal estrogen is very important at keeping the bladder healthy, so that is definitely something we want to look at replacing if we're in that time of life where we just don't have as much estrogen. So.
And just to make sure, in case a woman isn't sure if she has one or has had one, what are the common symptoms that might make us think we have a UTI?
Most commonly, it's going to be pain with urination. So it's going to be burning, kind of stinging discomfort when we urinate. It also tends to be associated with just feeling like you have to go to the bathroom a lot more. That kind of urgency, frequency, just feeling like I'm having to run to the bathroom, run to the bathroom, run to the bathroom.
Okay, so uterine fibroids is another thing that we hear women talk about a lot. What is a fibroid? What are the treatment options, signs, symptoms, all the stuff?
So fibroids are actually really, really common. And basically what it is, it's a growth of the wall of the uterus. So your uterus is composed of muscle.
Okay.
And if that muscle starts growing, it can create a little extra tumor, a little extra ball of muscle. And we call that a fibroid.
Okay.
Fibroids are very common. They're typically benign. Many women will have fibroids and they won't cause any issues at all.
Okay.
But if the fibroids grow, or depending on their location in the uterus, we can definitely see a lot of symptoms from them. If fibroids grow and become very large, sometimes people feel like there's a mass effect. They
Okay.
can actually feel like there's something in the belly. Other times, if the fibroids are close to the lining of the uterus, they can be associated with really heavy periods.
Okay.
And fibroids, if they're not causing problems, we don't necessarily have to treat them just to treat them. But treatments can range anywhere from birth control pills. We have medicine now that blocks hormones that contribute to the fibroids bleeding. Sometimes they need surgical management where not only hysterectomy, but then sometimes you can go in and just remove the fibroid that's creating problems. We also have newer things like embolization where not me, but that would be interventional radiology, where they can go in and kind of cut off the blood supply to the fibroid. So the nice thing is we have lots of options now.
Okay, great. And do we think they're hereditary? Do we know enough yet?
That can be a part of it, but then sometimes too they're just spontaneous, where mom didn't necessarily have that, and people just end up getting them. So
Okay, so maybe just two more kind of closing things that people might deal with. Painful intercourse and endometriosis. So can you hit on each of those for us?
Yeah, painful intercourse many times is also going to be a function of just changing hormones, and replacing those hormones usually can make a big difference with that. We also have physical therapy for that. Endometriosis is also something very much like fibroids. It's very common, and that's also something that we have treatment for, anywhere from medication to surgery.
I'm so proud that we're talking about things like this. I feel like in society, in the media, maybe even in our friendship groups, sometimes women don't talk about these issues as much as we could and should. So is there anything that we can encourage women, your patients, society? What can we do to make these less of a stigma, talking about these issues, and just more common?
I think that's exactly it. I think just talking about what you're going through, just sharing those experiences, so that if, people are mentioning something and maybe they don't know treatment is available, and that, their friends or family can point out, what, we can do something about that, and get them connected to the right person. So,
because lots of times I feel like if we do mention it or talking about it, it's kind of like a joke, like, oh, well, that's just something we have to deal with as we age or being a woman, but that's not the case.
That is really true. I mean, a lot of this, yes, it's very normal, it's very common, but just because it's normal and common doesn't mean you have to live with it. So definitely most of these things, you don't have to suffer. We've got treatments.
So if you had one kind of concluding statement, is there one thing you want to shout from the rooftops, make sure women and men know about urogynecology and pelvic health? What would that one thing be?
I think it's kind of what we had already touched on a little bit, just like don't be afraid to speak up. Just because it's normal, just because people have these issues, doesn't mean you have to live with it. So speak up.
Great. So thank you again for being with us. If patients feel like they are dealing with any of these symptoms and they want to seek out help, how do they find you?
Yeah, so my office, we do require referrals, so speaking to either primary care or their OB/GYN is a good first place to start.
So just mention that to the doctor that you're already seeing, and then they can help get them into you.
Yes.
Okay. Thank you again for being here. We've covered so many different topics. I feel like we could have you back for a future episode to really drill deep into one of these, so be looking for that.
Absolutely, thank you.